Hi everyone, my name is Melissa Sherry and I'm going to be talking today about strengthening the essential public health functions at the community level. So just a brief overview of the presentation today. We're going to start with why focusing on communities is important for public health. We're going to talk a little bit about building platforms for public health functions at the community level. Go into a little bit on measuring, developing, and strengthening community platforms for health. And finally talk about a way forward for strengthening public health at the community level along with some concluding statements. So why focus on community public health? One of the main reasons is to integrate community members into decision-making and action around health issues. The next reason is to think about extending and gathering resources for public health across other government sectors as well, across civil society, and across the private sector. We also could use community public health efforts to reduce duplication across vertical programs if we think about community as the horizontal. And finally, we want to strengthen visibility of public health as a key consideration in multiple sectors, which can be done using the community. Platforms for public health practice. So defining a community platform. A community platform can be thought of as a partnership formed in order to assess and ensure population health. It's also a strategy for local health departments to practice public health, as community platforms help us provide insight into local health priorities. It helps us provide health information and advocacy in the community. Community platforms can help expand human and capital resources, especially in areas where public health systems are low in these areas. It can help us interface between public health and community, and it provides a mechanism to coordinate vertical programs. So the role of community platforms, we can think about strong community platforms as being the mechanism from which public health cycles can be carried out. So as you'll see in this diagram, community platforms can serve as mechanisms to actually go through this public health cycle, starting with monitoring and population health. So community platforms can actually help identify issues in the community. They can review data and prioritize actions in terms of what the community actually wants to focus on in terms of health needs. The community can also help carry out the act phase of this cycle, in which they're able to participate in rolling out interventions that affect population health. So where's the evidence? There's actually a large body of evidence that helps us understand the effects of community participation in public health. We've seen improvements in health knowledge, in service quality, and in health outcomes. Now, this also is related to success factors for community health platforms. So some of the success factors that make these things possible are when the community is engaging in real power sharing between public health or other entities carrying out public health cycles, providing bidirectional learning between the community and others working in the health area, incorporating communities into protocol development, and using culturally competent health workers for intervention delivery. So there's different types of community platforms for health that we can think about. They come in all different forms, and some of the examples are health committees, community health worker interventions, community participatory research, health scorecards, and community advisory boards for NGO projects, among others. In terms of measuring community platforms, there's a lot of different ways we could think about this. Here we've conceptualized what Draper and others consider dimensions to measure. So leadership on agenda setting, this really gets at, is the community involved in leading the agenda? Are they setting the agenda? Are they providing leadership for the interventions? In planning and management, is the community really involved in carrying out interventions and other health-related activities? Women's involvement, where we're concerned with making sure that everyone in the community has a voice. External support and finance, which is basically sustainability. Is there financial and other support means for community platforms to go forward? Monitoring and evaluation, in which case communities are involved in evaluating how things are going in terms of interventions and providing feedback and other quality improvement information to move forward and improve interventions. Inclusion of intended beneficiaries. And finally, each of these is measured on a scale, and for more information, you can see the link attached with the Draper paper. A scale for inclusiveness. So measuring the inclusiveness of community participation, this is one way to think about it. This is from Rosato and others, and this is really thought of inclusiveness on a continuum, starting with information sharing on the left-hand side. Information sharing is really just where an external body is sharing information with the community, but not necessarily involving them. Consultation involves actually consulting with the community and getting their opinions, although not necessarily letting them drive or take action. Collaboration, which is more inclusive. It involves the community platform working closely to carry out the public health cycles. And finally, full responsibility, where the community actually takes ownership of projects and the public health cycles that we saw earlier. So in terms of a continuum of thinking about community health platform performance, this is one we've put together where, as you'll see on the left-hand side, as we move up in levels, we're increasing sophistication and performance of community platforms. Level 1 is poor functioning, not accountable. The community does not have a strong say in health activities, and in general, there's not a strong community platform at this level. In level 2, the community platform may be contractor or donor driven and may not coordinate across sectors. Level 3 involves sector-wide partnerships with strong community involvement, working to address burden of disease, but unsuccessful in improving health outcomes. So it's approaching level 4, but still needs to be a little more sophisticated at this point. And in level 4, all sectors in the community are involved in creating health in all policies. Multiple sectors are engaged, and we see improvements in health outcomes. So a way forward for health systems, what can we do? So regular and systematic essential public health function assessment, promoting and measuring the inclusiveness of community engagement, supporting and mentoring local attention to the community in the form of small grants to support community forums, inventory of stakeholders and communities, and finally identifying and celebrating the best practices that we do see across communities. Some key factors for success in community platforms are thinking about giving the community access to data about health problems and threats, the means and will to share data and control with community members in a bidirectional partnership, and advocacy to maintain community engagement against pressure to consolidate that control. In conclusion, communities can evolve strong engagement when certain factors are present. Community platforms can be strong complements to vertical programs. Community platforms can provide needed resources and expertise to extend limited resources that we often see. And political will generated is the basis of sustainable and resilient health systems. For more information, please see the links attached to this presentation. Thank you.